not everyone feels that they have the ability to connect. They may not live in a city with these facilities, or they might live in a rural area. One of the main stated goals of Boys of Summer at this point is to try to connect as many communities and services as possible so that people have the opportunity to live their best lives while we do what we can and wish the top researchers well in finding the cure. Living the best we can is really where I'm at. So we're talking about telehealth. And you tell me what telehealth is, and give me a brief description of this survey or this study that we're working on together.
Yeah, so I'm working with researchers at the University of Wyoming. They are speech language pathologists and also pharmacists, and I'm the physical therapy arm of it. But we're trying to bring healthcare to people who live in rural areas and who have Parkinson's disease and don't have access to somebody who has expertise in Parkinson's disease. And so they're isolated from the type of care that they deserve. Incidentally, we do have people even in Las Vegas who are isolated from that same type of care. We have what we call medical deserts. So there's areas in Las Vegas that are not in close proximity to that same type of care. And so the idea of this telehealth is that we would bring the physical therapy, the pharmacy, and the speech therapy to the participant. And in this particular study, it is about rural health, so bringing it to people in rural environments. And so we connect with people through a laptop. We exercise with them. We do speech therapy, and we manage their medications through a laptop that we provide to participants. And I think it's an awesome opportunity for people who are out there in the rural area to participate in and get the kind of care that they deserve.
So for the people with Parkinson's that find out about this, and this is largely my job, again, full disclosure, that I'll be reaching out to them, and I'll be giving them basically the opportunity, right, and telling them, here's what you can get from this, and here's the cost to you, zero, except for your time. And here is the potential benefit to you. So it's a bit of a sales job, but a sales of, I think, hope almost, because with a lot of people with Parkinson's, in my experience, that fits into the isolation, the potential depression. They feel like there's just nothing for me. I'm going to crawl into this hole, watch TV, and I don't mean to denigrate TV entirely, but whatever the behavior is, and not do anything. Where this is saying, hey, wait, you live in a place that may not have the facilities, or one of those medical deserts, which I love that term, and we'll explore that another time. And there is opportunity to connect in this new way. Now, here's the next thing. Person says, hey, wait a minute, I don't know anything about technology. I can't handle a laptop. What do we say there?
Well, we say we have people like Robert Cochran who's agreed to help us on this study and to recruit participants and help onboard participants. And help them. If you're technologically challenged, we will help you. We will help you get connected. We will help you learn how to use the laptop and how to connect with people. And the people that have participated so far have really loved it. I mean, we have really good people that are helping. Jennifer Nash, actually, she's a physical therapist who has a lot of expertise in Parkinson's disease. She's the physical therapist on the project, so you'd be able to connect with one of the experts in Nevada, actually in the western United States, in Parkinson's disease, and have her be right in your family room or your bedroom, helping you do exercise. And so I think it's a great opportunity, and it may be a little bit scary because of having to operate a laptop, but we'll walk you through it. We'll help you do it, and it is. It's a great opportunity, and it's free. Yeah, that's the other thing, is it's free.
Yeah, that's what I heard. And opportunity-wise, the idea that this laptop, it's about as simple as it gets, that there's just a couple of icons on there, and you can have a hard copy of your schedule, and here are the hours, and you just say, I'm going to click this button at this time, and boom, like you said, there's Dr. Nash in there with you, or there's Meryl in there with you, or here's the Lee Silverman voice therapy training program. So those things are at the convenience, and really they are just a click away. I know technology often promises that, But from what I've seen, this really does look that simple. And yeah, well, I will be out there fishing for you, and we'll do the best to help people see what a great benefit this is to them personally, and that they're doing something on a larger scale too, to make the entire possibility of having Parkinson's easier.
Well, we do appreciate your help on this, Robert. I know you're one of our, recruiting managers, and we really genuinely appreciate your efforts on this project. But we do have some haste with this a little bit because our funding does run out June 30th. That is June 30th of 2018. So if you are interested or know somebody that's interested, it's best to make the connection as soon as possible because we won't be doing this after June 30th. But if we find good results out of this trial, we will propose a larger scale trial that will be funded by a major national organization called PCORI. Now, we need to have enough participants, though, to see that this is effective and to see that it's safe and see that it's feasible. If we don't have that data, we won't probably be able to extend this trial any further. So we do need your help. If you have Parkinson's disease, like I said, or you have know somebody who could benefit from this, please let Robert know. And we would love to have the participation.
Thank you for spelling out the risk opportunity so clearly there, because that's what people need to know. There's a deadline, there's an opportunity, and there's this great benefit. However, if we don't get this many here, we can't expand it to be what it needs to be. So super. I think we've done our job here this morning, Merrill.
Hey, thank you. It was a pleasure talking to you.
Pleasure talking to you too, and we'll be talking again soon. For Faces of Parkinson's, this is Robert Cochran. We'll see you next time.